We go now to Lora, Windsor with a report on a treatment for lipedema.
It is estimated that more than 17 million people in the United States are currently suffering with lipedema. It strikes thin and overweight individuals, and no amount of diet or exercise can stop it. We spoke with Dr. David Amron, a board-certified dermatologic surgeon. Dr. Amron is offering new hope for the millions of people suffering with lipedema.
Well, lipedema is a chronic fat storage disease of the subcutaneous fat tissue where it's primarily women, commonly genetic, where they get fat deposits in their legs that usually presents in puberty or their 20s, and specifically the legs take on a very tree-like, column-like look to them, and it involves mostly the calves and ankles with a cuffing around the calves and ankles, the thighs kind of circumferentially all around, and many times the arms. But it's not only just disfiguring cosmetically, which it can be, but it's very painful too. There's pain, there's numbness, there's decreased mobility in these patients, and they really are suffering. Many of them actually can't get out of bed when it goes on to its later stages. I would say lipedema's most commonly misdiagnosed is just literally obesity, and that's the pain that some of these women carry with them. They're told just to go lose weight, exercise, diet. You're not doing your part of things. Not only by friends and people like that, but by professionals, by physicians. They're misdiagnosing it as just obesity. But these women really have a disease. This is a specific condition. But I also really want to mention that this is a different condition than lymphedema. Many times people confuse the two conditions. Lipedema is a primarily fat storage condition that can many times have the swelling later on, whereas lymphedema is primarily a vascular condition of lymphatics as the primary problem. The mainstay of treatment is compression therapy, either wrapping the legs or manual lymphatic drainage to remove some of the fluid there, but it's really just a temporary relief. There's also some medicines that are commonly used to treat lipedema, many of them anti-inflammatory medications that have some benefit to reduce swelling, but really the only treatment or potential cure for lipedema is liposuction surgery.
When I was a preteen, I started noticing that my legs were shaped a lot differently, and kids would tease me a lot. They would call me names like Thunder Thighs. I'd only known that something may exist because I'd seen my great-grandmother struggle with it. And my grandmother and my mom, although she had bariatric surgery and is skin and bones from the waist up, she's got very large legs. What prompted me to come to Dr. Amron was that I'd been searching for a solution. I'd learned that tumescent liposuction has very good long-term results for people who suffer with lipedema. It can halt the progression of lipedema and even reverse it, so that I won't suffer from secondary lymphedema and other comorbidities that come along.
With lipedema patients, it's important to have a very specific technique, and my approach, first of all, is under local anesthesia where the patient is conscious, and it's also a way of doing it that is lymphatic sparing, where there's no chance of damaging the deeper lymphatics. So I have a very specific way of going about it in these patients with micro-liposuction. Sometimes I use laser in it, but it's very specific to this condition. Lipedema is not an easy condition to treat with liposuction surgery unless the surgeon is highly skilled in it. This is not just beginner liposuction. These are areas that many surgeons really avoid doing liposuction surgery, such as the calves and ankles, circumferentially all the way around, from the knees down to the ankles, the thighs all the way around, specifically the anterior thighs and knees. These are historically, traditionally very difficult areas to do with liposuction surgery, and really should only be done by somebody with extensive experience.
With Dr. Amron using his decades of liposuction experience, he is helping lipedema patients regain mobility, rebuild confidence, and put an end to their chronic pain. For the American Health Journal, I'm Lora Windsor.